And I also think we have to take a step back. I hadn't been CEO that long when we ran into one of the worst crises that any of us probably have faced in our careers with the really challenging COVID pandemic. And first, I would say there were a few months where I thought, wow, there's a really dramatic decrease in activity. I find the resilience that the aesthetic space have shown, how fast it's come back, whether it's in plastic surgery, whether it's plastic aesthetics, whether it's in med spas, whether it's traditional dermatology. I've been really impressed how fast it's come back, how resilient it is. Because when you look at the numbers, there is a pent-up demand. What is the penetration in the US? 5-10% or something like that?
Single digits.
So I think that this has been the thing that has impressed me the most. And I had an opportunity to talk to a few of your colleagues in the aesthetic space and, ask them, how are you going to manage this situation? And the fact that people have adapted their practices, virtual pre-consultation, then patients or consumers wait out in the parking lot, they come in, they have a quick treatment, and then, they go out. Of course, if they have surgery, a little bit different. But the adaptation and the innovation and the agility that this field has shown, and you see it in the numbers, we're going to have a very strong year. I'm sure our competition is going to have a very strong year. This market is really resilient. There's a lot of pent-up demand, and I think if you come out with innovative products, I think we've shown that with Restylane Kiss, and you basically launch it digitally, people respond.
Yes. And you also partnered with another company. When you launched Kiss, you also partnered with Alastin in their new product Enhance, which minimizes the bruising as well as the swelling. And that was a very innovative partnership of two companies, Galderma as well as Alastin. We have
multiple partnerships, Mentor and others, and what we have seen is that even though I think in the space we're a relatively large company, but we benefit and they benefit from these collaborations because we can serve our customers better when multiple organizations talk to the customers. They have multiple products. There's clearly some overlaps, and it also increases the reach and the frequency that we can have. And particularly in a time where a lot of the interactions is now virtual, this is another way of getting more interactions. So I find this is a great way forward. But I think we could also do more on the innovation side. There's more people that we could collaborate with. But for me, it's really very important that we try to stay at the forefront. And as I mentioned initially, I'm a physician, so you can imagine I'm into the science, I'm into understanding what is going on, the clinical trials, what's the sample size, what's the next thing, how do we launch something new, what are the newest things, what is happening in the toxin space, what's happening in the filler space, what's happening with Sculptor. And I would say, pushing gently the team that we innovate even fast and we invest more in that space.
Uh-huh. Well, that's wonderful. We love companies that are driven by science and not just marketing. So I applaud your efforts. I think it's fantastic. You're a physician and a scientist first before being the CEO. And I welcome you into this aesthetic space. It's wonderful to hear your thoughts about it.